Here we are going to talk about the clinical manifestations of iron deficiency anemia. The classic triad of symptoms is pallor, fatigue, and shortness of breath on exertion, dyspnea on exertion, to use the clinical term. All three of these stem from the same underlying mechanism. When hemoglobin falls, the blood carries less oxygen per unit volume, and the tissues start to feel the effects. The pallor reflects reduced oxyhemoglobin in the circulation. The fatigue reflects inadequate oxygen delivery to muscles. The dyspnea on exertion reflects the cardiovascular system's inability to compensate fully when demands increase during physical activity. There is an additional cardiovascular consideration worth flagging. In individuals who already have narrowed coronary arteries from atherosclerotic disease, the reduced oxygen carrying capacity of anemia can tip them into angina pectoris. The heart muscle, already working with a compromised blood supply, becomes even more vulnerable when the oxygen content of that blood is reduced. So iron deficiency anemia does not just cause fatigue. In the right patient, it can unmask or worsen coronary insufficiency. When the deficiency is severe and has been present for a long time, a cluster of more unusual findings can appear. The tongue may become inflamed, a condition called glossitis. The stomach lining can become irritated, producing gastritis. And nails can undergo a characteristic transformation where they lose their normal slightly convex shape and instead become concave, like a spoon. This is called koilonychia, and the text specifically describes it as spooning of the nails. This physical finding reflects prolonged, severe deficiency, not a mild or early case. Some individuals develop pica, which is the craving for non-food substances. The specific substances craved can vary widely, but the phenomenon is strongly associated with iron deficiency and often resolves with treatment. Finally, there's Plummer-Vinson syndrome, a clinically important association where iron deficiency coexists with a thin web of tissue that partially obstructs the upper portion of the esophagus. This web can cause difficulty swallowing, and the syndrome is significant because it has historically been associated with an elevated risk of esophageal carcinoma. In summary, iron deficiency anemia may be asymptomatic, particularly if it develops slowly, but common clinical manifestations include fatigue, pallor, exertional dyspnea, weakness, headache, dizziness, and, in more severe or chronic cases, features specific to iron deficiency such as pica, especially craving ice, restless leg syndrome, brittle or spoon-shaped nails, koilonychia, angular stomatitis, atrophic glossitis, alopecia, and, rarely, dysphagia from Plummer-Vinson syndrome. Children experience irritability, poor feeding, and neurocognitive impairment. Physical findings include pallor of conjunctiva, skin, and nail beds. The next section is on lab findings.